Testosterone is frequently referred to as the male hormone, and its deficiency is often diagnosed as hypogonadism. This is somewhat of a misnomer, but it is true that testosterone is the androgen hormone which is primarily responsible for the development of male characteristics. But women need it too, and without it, there would be no men at all. If you are an American living in the USA and think that you might have low testosterone, call our American HRT Medical Clinic to discuss prescription options. Call 1-800-469-3343. Of course, testosterone is more complicated than it might seem at first, and it is actually acutely important for female health as well. They just don't need nearly as much. Women need a fraction. Testosterone is responsible for the development of both primary and secondary male sexual characteristics. In the womb, it causes the growing fetus to differentiate and create the male sex organs. Some theories point to hormone imbalances in the womb causing later gender dysphoria. During puberty, testosterone encourages the young boy to develop into a man. It is responsible for the growth of the male penis and can often cause tenderness in the nipples. Also, human growth hormone is responsible for the growth spurt that occurs in both boys and girls during this period, but testosterone encourages boys to grow taller than girls and also encourages further sexual differentiation, including the development of body hair, the deepening of the voice, and the strengthening of the muscles. Many men have this idea that testosterone is only important because of its influence on male sex drive, muscle development, assertive mindset, and sexual ability. But this is simply not the case. Men need testosterone for a lot of reasons. Testosterone is the hormone which often defines a male as a man, because men have several factors, higher levels of testosterone. And when testosterone deficiency becomes problematic, men often experience the equivalent of a reversion into their younger, less virile state and more prone to swings of emotion. Men with hypogonadism or andropause become more prone to anxiety and passiveness. They lose their muscle strength, bone mineral density, and their interest in sexuality. They can even experience thinning beard and body hair. This doesn't even get into the underlying issues that low T can cause, increasing the risk of obesity and a variety of heart and cardiovascular conditions, just to name a few. 1/3 of men who have heart attacks have low T, so there appears to be a correlation, but how much causation is debated amongst doctors and physician scientists. The issues with psychology and motivation are so strong that doctors have even given it a name: grumpy old man syndrome. Testosterone deficiency causes men to lose that spark that sustains them, that pep in their step, and causes them to become agitated, irritated, submissive, and exhausted. That's no way to live. Luckily, advances in modern science are a wonderful thing, and there are a wide variety of treatments available designed to treat your low T and restore your health and vitality. Collectively, these products are known as bioidentical testosterone treatment protocols, and they can change your life. Testosterone products comes in many forms: injections, gel, cream, pellets, and even nasal sprays. However, be aware that many of the testosterone pills and supplements sold on the internet in tablet or powder form are fake. Only get testosterone through a licensed physician. You can contact our legitimate clinic to talk about your choices. Testosterone is integrally important for optimal male physiological and psychological vitality, and for men that aren't producing enough of the vital hormone, low T treatments can allow them to optimize their health, mind state, and virility in a way that they never thought possible. Testosterone can help you stay strong, ward off fat, and stay sexually active. Testosterone replenishment to bring clinically declining levels up to the optimized levels can do a world of wonders. Testosterone can also help you in maintaining sharper focus and cognitive clarity, while also amplifying good mood and positive motivation. Andropause and low T are trendy terms regarding men, created to more or less describe the medical condition of male hypogonadism that is characterized by clinically low testosterone production that is associated with a cluster of medical symptoms which deteriorate male health. The condition is also known by a number of different names, including most commonly testosterone deficiency or hypogonadism. Most commonly, men that experience low T experience their symptoms as a result of the normal aging process. As a man grows older, his body becomes less able to produce testosterone to meet the needs of the body, and there are a number of reasons why this happens. Generally, this decline begins in the late 20s, but becomes symptomatic in the late 30s or later. Sometimes this medical issue can happen earlier because of congenital or physical trauma. When low T is caused by aging, it is often known by a multiple of names, including age-related low T, age-related testosterone deficiency, and more recently, andropause, as discussed previously. Scientists are just recently becoming more aware of male hormone decline associated with aging, and have discovered that there are many similarities between the female menopause and the male andropause or menopause. Menopause occurs more abruptly, but men experience a core series of hormonal changes as they grow older, which often impacts their ability to live a happy and healthy life. Menopause generally sneaks up on men in their 30s and 40s, but is really felt significantly in their 50s and 60s. Testosterone levels reach their highest levels in our teens, during and after puberty, and they remain very high through the 20s, even though they are declining. Starting somewhere between around 27 and 33, testosterone levels start to drop off more noticeably. This decline is slow, only around 1 to 2% per year, and is dependent on many variables depending on genetics, lifestyle behaviors, and type of eating regimen/diet or food intake. Because the decline is so slow, men generally don't experience symptoms of andropause for many years. One predicting factor of low T causation is obesity. There is strong evidence that belly fat can contribute to testosterone levels falling. Testosterone deficiency is a multifaceted medical disorder which impacts the male body down to some of its core processes. There are noticeable physical and psychological effects, and there are many physiological symptoms of low T, which may not be recognized until they have already had a detrimental effect on the human body. Testosterone has a big effect on mental outlook. Here are some of the symptoms of testosterone deficiency. Understand that this is just an abridged list, and not all patients have the same experience. Every man experiences andropause and low T in a generally similar but also unique way, based upon their DNA, environment, BMI, and other lifestyle factors. Patients find it harder to maintain muscle mass even though they haven't changed their habits. It becomes harder to stay at a healthy weight even though the patient maintains the same nutrition routine and exercise regimen. Testosterone is directly responsible for the appearance of male body hair, and as testosterone levels decline, hair thickness will diminish. Amount of hair can decline as well. As testosterone levels drop, the testicles lose their fullness and can even retract slightly. When men go on testosterone replacement, they take HCG injections subcutaneously to keep the stimulation of the testicles so they remain healthy. Testosterone is responsible for the physical processes which lead to happy libido and healthy sex. Without sufficient testosterone, men start to have trouble building and maintaining a healthy erection. Men also experience shorter erections and have trouble achieving orgasm as effectively. One of the most persistent symptoms related to testosterone deficiency and low T is increased feelings of tiredness and fatigue. The body simply isn't able to go as hard as it used to. In terms of physical health, this means that you won't be able to work out as hard or for as long as you used to. Testosterone is responsible for many male psychological characteristics, specifically those related to confidence and assertiveness. Men with low T are more likely to experience elevated anxiety levels. Changes in the male body and mind often lead men to experience symptoms of depression as a result of their physiological decline. Also, healthy testosterone levels promote optimal psychological balance, and as andropause sets in, it can neurologically lead to an increased incidence of depression and feelings of despair. Connected to decline in physical sexual function, men also frequently experience a diminished desire for sexual activity, resulting directly from their testosterone deficiency. This symptom is both psychological and biological. Suzanne Summers recalls that her sex life with her husband did a 180-degree change in the right direction after he went on testosterone replacement. Men with low T have trouble keying into the instinctual alpha characteristics which are inherently related to testosterone, which leads to a lack of confidence and ability to assert oneself. The lack of energy associated with hypogonadism and low T impacts psychological as well as physical health. The active focus is biologically draining, and if you are exhausted and fatigued, you'll have issues maintaining attention span and remembering key facts and figures. Testosterone balances cholesterol, which, if left uncontrolled, can have a detrimental impact on blood pressure. When men have low T, they tend to have more bad, or LDL, cholesterol and less good, or HDL, cholesterol. Low T also increases the prevalence and risks associated with high triglycerides. Testosterone not only makes the muscles strong, it also helps keep the bone strong. Without sufficient testosterone, the risk of osteoporosis and osteopenia increases significantly. Men with low T lose their ability to produce sufficient fertilized sperm for easy fertilization. Although testosterone therapy cannot alleviate the fertility issues associated with low T, HCG with testosterone can increase sperm production while simultaneously providing the benefits of testosterone therapy. Testosterone belongs to a class of hormones known as anabolic steroids. These hormones are all building hormones, which means that they cause the body to distribute resources and develop more effectively. When the body does not have a sufficient supply of energy reaching the right places, the body starts to slow down in a litany of different ways. Stay tuned for part 2 in this video series discussing low testosterone and how to treat it effectively.